Citizen Digital.
Now, there is much in the in tray for the new man at the helm of the Health Ministry, with the complaints about doctors, funding, and the implementation and rollout of universal healthcare under the Social Health Authority at the different levels of hospitals. But how do those levels work? My explainer tonight is on the categorization of hospitals and how they work. The categorization is guided by Gazette Notice number 269 of December 2021. Under the KMPDC Act that outlines levels of care and categorization of services. Let's begin with level 1, which is the basic unit of provision of healthcare in the country. Here, there is no physical infrastructure. The population in the community is organized into community health units, each with about 1,000 households. These are manned by the community health providers, or CHPs. At this level, it is basically preventive and promotive health services that are provided. Now, they have three major roles. One is to relay the messages of the government to the people. Two, it's to connect or link those populations to the nearest health facility, such as levels 2 and 3. And then there is the preventive care and screening for such things as blood pressure, diabetes, and malaria. Checking for children with fevers and advising if it requires more specialized medical attention. Now, at this point, they also do tracing of children to ensure they don't miss their immunization shots, or during outbreaks such as Mpox, measles, among others. Now, the CHPs are supervised by county health extension workers. The next level is level 2. This is the dispensary. Here we now have a physical structure, and one would expect to see here an ambulance and some power backup system. At this level, it is a lower scope of health services that are provided. Basic outpatient care, antenatal care, mother and child care, whereby they check on the nutrition and growth of the child. Basic tests are run here. Minor procedures, wound dressing, and basic emergency services. Now, some maternity delivery services can happen here, the ones without complications. Treatment for primary health care can be given here as well. Painkillers like Panadol, antibiotics like Amoxil, and malaria medicines. Now, this would also be typically the first stop for GBV victims. At this level, you would see community dental clinics, eye clinics. By the way, home-based care is also provided here. Oh, and funeral homes, or mortuaries as they used to be known, are also classified as level 2 facilities. Now, these centers are managed by nurses. You can have public health officers here too, lab tech, nutritional technicians as well. Let's now move to level 3. Now, here you will find what is known as a health center. Here, you now start to get some inpatient services that are provided. In terms of infrastructure, expect to see male and female wards, pediatric and maternity wards, and their attendant facilities like kitchen and laundry that support inpatient services. People here can be admitted for short stays at the center, 2, 3, 4, maybe 5 days. Minor theatre procedures can be conducted here, like splints for bone fractures, including maternity operative deliveries, like C-sections for some. You can also have some imaging services that you can get here, like ultrasounds and x-rays, and more upgraded laboratory services. The healthcare workers here are clinical officers and nurses to provide the more specialized services that are available here. Now, there should also typically be a visiting resident who comes in a few times a week. Now, ideally at this level, there's 3A, 3B, and 3C levels, with 3A providing the most specialized care and surgical procedures at this level. Now, at level 4, the facility is now called a hospital. The full range of treatments and surgical procedures are provided here. Treatment services provided here are basic cancer, ophthalmology, dialysis, pediatrics, ENT. So you will expect to see some specialized centers here providing those services. Also, there will be some more diagnostics, some more advanced diagnostics such as biopsies, and some more advanced imaging services such as CT scans. Now, level 4 hospitals should ideally have 3 theaters, one for minor one for maternity cases and one for other cases. Level 4 hospitals are manned by health officers with specialized postgraduate training, such as graduate dentists, graduate pharmacists, ICU nurses, etc. Here, there will be a resident specialist in all the major disciplines. Now, these serve as the referral hospitals for the county. If all things work perfectly, then 80% of the cases within a county should ideally be sorted out at this level without needing to go any further. But should you need to, there is, of course, level 5 hospitals that provide even more specialized care in areas such as neurosurgery and orthopedics, rheumatology, cardiology, and some extensive cancer surgeries. Consultant doctors are the providers here. Expect to see ICU, HDU, burn units, critical care specialists. And up until this point, let's remind you the facilities are managed by counties. So that's level 1 all the way to 5, right? So level 6 hospitals, this is the highest care, are managed by the national government. They handle even greater levels of specialization. So here you've got super specialists, or I think they're called subspecialists, handling even more delicate procedures. So if it is orthopedics, think of a multi-trauma surgeon. If it's cardiology, think of an electrophysiologist who can insert a pacemaker. If it's renal care, think of a transplant specialist. For kidneys, think of liver transplants or even a hematology oncologist. Big words, I know, but that's just to show you the level of advanced care that is or should be available at a level 6 facility. Now, like I said, this is run by the national government. It actually runs similar to a parastatal or a semi-autonomous government agency, what are known as SAGAs. Now, they have a board, they have a CEO, and they have a budget line from the government. One example is Jaramogi Oginga Odinga Teaching and Referral Hospital that recently joined this status and I think received upwards of 1 billion shillings from the national budget. Now, at this point, there are 6 level 6 hospitals in the country. Kenyatta National Hospital, the Kenyatta University Teaching and Referral Hospital, the Jaramogi Oginga Odinga Hospital, the Mathare Hospital, Spinal Injury, and Moi Teaching and Referral Hospital in Eldoret, known as MTRH. Now, they also often engage in research, and you'll find that most, if not all of them, are linked to teaching institutions or universities. In addition to this, there are about 11 level 5s, over 90 level 4 hospitals, and what public healthcare officials tell me, over 8,000 level 3 and below facilities that are spread out across the country. Now, in an ideal situation, you can't walk into K&H or these with a cold. You're supposed to work the system from the lower levels going upwards. Now, like we said, it's ideal. This doesn't always work because of funding, staffing, and operational issues at the lower levels. But this is the ideal. Now, one last thing, the counties manage, run, and staff and fund the hospitals and healthcare centers up to level 5. The national government does the level 6, but also sets policies, standards, and guidelines, and in some instances provides capacity assistance, such as sending specialists to some county-run facilities. So this is how the public healthcare system works. The next time there is a conversation about SHA and about which levels of hospitals where healthcare is being provided.